We're almost to the end of the pads. This is it. We've gone through them all already. White cells and nitrites are the last two pads that we're going to talk about today, looking for pyuria and bacteriuria. Bunch of definitions. Again, definitions are a great place to start. If you understand the definitions, it's a really great place to make sure you know kind of what you're doing. Definitions, glossary, and your objectives. Bacteriuria is bacteria in the urine. Very, very general. Yep, there's bacteria in the urine. Could be transient, could be infection. There's just bacteria in the urine. Leukocyturia, there are leukocytes in the urine. Pyuria, same thing as leukocytes, it's pus. Pyelonephritis, when you're dealing with pyelonephritis, you're talking about a kidney infection. Cystitis is a bladder infection. Urethritis, infection of the urethra. A lot of times we see this in sexually transmitted diseases such as chlamydia, Neisseria, and treponema. So these are things that we see as urethritis. Pyelonephritis, cystitis, urethritis are all UTIs, urinary tract infections. So if somebody has a UTI, it can be anywhere in the urinary system. So we don't know whether it's high or low or what's going on. They just say UTI. So, formation of nitrates. We're going to start with nitrites, we're going to end with white cells. So, nitrites, formation of the nitrates in the urine. So, people are like, what do nitrites have to do with it? Well, nitrites come from nitrates, and certain Enterobacteriaceae convert the nitrates to nitrites. And if I'm not mistaken, Enterobacteriaceae has a new name. Shoot, I'll have to look into that. If I'm not mistaken, it switched names again. You know how micro is always changing names? I think that group got changed. But anyway, so the Enterobacteriaceae family, especially E. coli and Proteus, which are two fecal contaminations that often cause UTIs, convert the nitrate to nitrite. So it's an indicator. We're not actually testing for the bacteria. It's an indirect method when we're looking for detection of the infections because we're detecting the metabolic breakdown products. Nitrates are present in the urine due to our diet. Green leafy vegetables in particular have a lot of nitrates. So people who eat a lot of salads have a lot of nitrates. If your diet consists of mac and cheese, ramen noodles, and pizza, not as many nitrates in your system. So we'll talk about why that's important later. Most bacteria that cause UTI are able to convert the nitrates to the nitrites. Not all do, but most of the ones that cause most UTIs are able to. And so positive nitrites, also often are detected before there are actually even symptoms because the bacteria are there, but they haven't grown enough and caused enough problems yet to be symptomatic. So a lot of times you can see these nitrites even before you get symptoms. A little bit about frequency. Females in general are 30 times more likely to get a UTI than males. One, location of the urethra, right? You know, it's only like that far from the anus. It's really close to where all that fecal material comes out. Two, shorter urethra. Females have a much shorter urethra than males, so when you're getting that transient bacteria that work its way out, it's a lot less time. It doesn't take as long because it's a much shorter tract. And in pregnancy. Pregnancy seems to cause it also. The methodology behind that, you know, there might be a couple different ways, but if you think about a pregnant woman with the baby sitting on the bladder, when they void, sometimes they don't completely void, so the bladder always has some left, you know, it's that complete voiding issue. And I think that's a lot of it, because urine is a great media to grow bacteria. Bacteria love urine. We are looking at pediatric patients. Newborns, very low frequency, but for some reason, male newborns are more frequently UTIs than females. I don't really understand it, but we see more in males than females. 2-year-olds, we see an increase in females with UTIs at that point. Around that 2-year age, you know, the potty training, I'm sure, has something to do with it and all of that. And in late teens and early 20s, we see a big spike usually. Now, as time has gone by, we're seeing it younger and younger. But with teenage girls having sex, honeymoon cystitis, it used to be called, because back in the day, you waited till your honeymoon, and, you know, lots of trauma to the urethra during sex. We're seeing that actually now in younger and younger females, so like earlier teens, mid-teens. When you get into your adults, the 20 to 40s, childbearing age and pregnancies, when we see a lot of female UTIs. Again, that pregnancy, you know, all that I always joke, pregnancy is like harsh on the body. I don't joke, I mean, it's harsh. And we talk about like all the things that can go wrong during pregnancy and all the problems you have. And until you go through it, it's like, oh my gosh, that was rough on my body, right? UTIs kind of spike during that time. 60 to 65, we actually see an increase in men getting them, and it's prostate issues. Again, inadequate voiding. You know, they're not completely able to empty the bladder. So we see an increase in men when they hit that age. The other group we see in catheterized patients, in an untreated catheter, so just a plain silicone catheter with no additives, is about 10% increased risk per day that catheter is in of a UTI. Now there's all sorts of newer catheters out there that have things in them. For example, the Bartix IC Foley catheter, I did a bunch of research on that, and we put silver into the catheter. So the silver particles are actually an antibacterial, so it prevents the bacteria from getting up into the catheter. But think about it, you put a catheter up to the urethra, you just made a hole really big for bacteria to get in and out of. I think we talked about catheters in general, the bags. People pick the bags up and put them up on the laps. Well, all that urine that's been sitting in the bag, and remember, urine is a great place for bacteria to grow, is now dumping right back into that bladder, right? So catheters are really, really high risk, and even with the additives, we've still increased the risk of urinary tract infection. The longer the catheter is in, the more increased risk you're going to have. So there's two types, of urinary tract infections, and it depends on how the bacteria get into the urinary system. We have the ascending route, ascending going up. Starts in the urethra, bacteria work their way up to the bladder, up to the kidneys. That's the ascending route. Commonly we see the fecal contamination organisms with that. Klebsiella, E. coli, Proteus, Enterobacter. They're all gram-negative rods, and all members of the Interbacteriaceae family are going to reduce the nitrates to the nitrites. So we'll catch them if they're going to be part of that family. Then there's the descending route, septicemia. Now, septicemia is never good. Bloodstream infections are never a good thing when people go into sepsis. And then what happens, it's called the homogeneous route because it seeds. It starts in the bloodstream, but the bacteria seed into the UTI, into the urinary system and cause a UTI that way. So that's descending route. Starts in the bloodstream, gets into the kidney, to the ureter, to the bladder. So it works its way down. So a positive nitrite is going to often indicate a UTI. As I said, the gram-negative family Interbacteriaceae is going to reduce your nitrates to nitrites. Normally, for this to happen, though, it has to be in the bladder for about 4 hours because you have to give the bacteria time to do its job. And if you don't have that urine there for that long, you're going to put some false negatives because it doesn't have time to convert that nitrate to a nitrite. So we want to make sure you give it the time. This is why we love that first morning specimen. Because if you're lucky, you've been able to sleep at least part of the night without getting up, and that bacteria has had time to do its thing and break down the nitrate to nitrite, so you're more likely to pick it up in that morning specimen. Other things we're going to see with somebody with a UTI, possibly, not always, but oftentimes with the UTI, we're going to see positive protein, positive leukocyte esterase, an alkaline pH, and a positive blood, all on the strips. So we'll see all those on the strips. So again, first morning specimen is what we're going to look for on this. The specimen is called the grease reaction. And you have the nitrite reacts with an aromatic amine and an acid pH to form a salt. The salt then is going to react with another aromatic compound to form an azodide that's pink in color. So you have to know it's the grease reaction, and it forms an diazomal salt. Pretty much that's really what you need to know about this reaction. Specificity, the reaction is very specific for nitrites. But not all bacteria can convert nitrates to nitrites. So just because it's very specific for nitrites, it's not specific for a UTI. Sensitivity, any pink color indicates greater than or equal to 100,000 microorganisms per mil. This is one of those tests, it's qualitative. You have a positive or a negative. Any pink is positive, not pink is a negative. Because a lot of it is dependent how long it's been in the bladder. You're going to have more, it's going to be darker if it's been in your bladder for 8 hours while you slept versus 2 hours. Doesn't make it any less there. So we're looking, is it there or is it not there? Interferences are false positives, old, improperly stored specimens. Okay? Like, remember we talked, the nurse collects a specimen, puts it on the counter, runs to the room next door for something going on, comes back later. Certain bacteria can double every 20 minutes. So a handful of bacteria can become a lot of bacteria in 2 hours. So improperly stored urines are going to be considered a false positive. Pigmented urines. This is one of those pads that are really the light buff color. Anything that pigments the urine is going to discolor the urine pad and make it look kind of that pinkish, orangish, reddish. Is it, isn't it? What's going on? So we see sometimes false positives with that also. False negatives. Insufficient incubation in the bladder. You need that time. If you're somebody and you go to the doctor and you have this urgency, right? Because you have dysuria, you get these urgencies with UTIs, and you go into the clinic and you go to the bathroom and you go up to the doctor and 20 minutes later they have you pee in a cup. Yeah, I can give you another urine, but it's only been 20 minutes since you emptied your bladder. You haven't given the bacteria time to convert. Insufficient dietary intake of nitrates. As I said, if your diet consists of mac and cheese, ramen, and pizza, you're not getting enough nitrates, so there's no nitrates for the bacteria to convert to nitrites. So we're going to see a false negative there. Ascorbic acid. Ascorbic acid. False negative. When in doubt, the answer is?
Ascorbic acid.
Ascorbic acid. Good. Bacteria which fail to reduce the nitrates to the nitrites. Gram-positive cocci do not convert nitrates to nitrites. Certain other organisms do not. But we really, gram-positive cocci in particular, and they can cause UTIs. So we sometimes will miss it on the nitrites because of that. Acidic concentrated urine, usually with UTIs, we see the more basic urine. So if it is more acidic, it's probably not a UTI, but it could be because, we've learned about how that all at the distal convoluted tubule balances out the pH of the bloodstream. So it could be, but for the most part, acidic urines, we're not going to see this too often on because the bacteria are making it basic. And abnormally high levels of urobilinogen also are going to cause this to be false negatives. So the second pad, which we primarily look at for infections, is going to be our Leukocyte Esterase pad. The clinical significance of this pad is we're looking for pyuria. We're looking for white cells in the urine. Leukocytes, we normally don't see in the urine. So when we see leukocytes in the urine, it's usually going to be an issue. Presence usually is going to indicate an inflammatory response. You get an infection, it's going to create an inflammatory response. Neutrophils respond to infections, and the granules in the neutrophils are going to help kill those bacteria because they contain the esterase. Remember from basic lab skills, the bacteria or the neutrophil engulfs the bacteria, puts it in a little phagosome. It combines with the lysosome. It breaks it all up, and then it exocyzes it out the other end. Right? That's what we're looking at in the urinary tract system with these with the white cells. So pyuria, here is a picture of kind of a pussy urine. It's real cloudy and white, just kind of icky. So in an infection, chemotaxis occurs. Chemotaxis, when I think of chemotaxis, I think of Marco Polo. Okay? Marco Polo, so you got the side of the infection, side of the trauma, whatever. It's going to start yelling, Marco! And then, the white cells are going to be going, Polo, where am I going? Marco! And so it knows where to pull itself out of the bloodstream into the area that it's heading towards. When it leaves the bloodstream, it uses a process called Diapedesis. The next slide, I'll show a picture. There's also videos in the module that show white cell migration, and it shows the white cells chasing the bacteria. Hopefully you've all looked at those. Once the white cell gets to the site of infection, phagocytosis occurs, and the bacteria get eaten, digested, killed, and exocyzed. So here's diapedesis. In the bloodstream, the white cells doing their thing, floating around the bloodstream. This guy's yelling Marco. They're tracking him down. Polo, Polo, where are we going? Oh, right here, Polo. Let's go through the cell wall right here, the main wall. This is diapedesis, following the cytokine gradient into the kidney or the bladder to kill the bacteria. So the principle of this test is very similar to the nitrite reaction. You get the leukocyte esterase and hydrolyzes the substrate ester of the pad, forms an alcohol with a ring. The aromatic ring then reacts with the salt to form a dye, and in this color, in this situation, it's a purple color. My favorite two pads on the urine strip are the last two, the pinks and the purples. They're just so pretty when they're positive. So that's going to be right here, the white cell. So it turns this really, really cool purple color. Specificity, it's very specific to the esterases found in granulocytes and histiocytes. What cells in the bloodstream are granulocytes?
Eosinophils, basophils, and neutrophils.
Correct. You guys know what a histiocyte is?
Isn't that what, like, the kidney reacts to histamines?
It's actually the macrophages. It's kind of like another name for another slight formation of a macrophage. I had to look it up.
Is it a mast cell? No.
Nope, it's not an actual mast cell. That's another, mast cells kind of are going off on a different area. We're not going to talk about mast cells. Mast cells get crazy. I'm not going there. Urine and mast cells we don't have to worry about. So when we're looking at these cells, we're looking primarily at the neutrophils, eosinophils, and basophils. The last group, we kind of did a lot of looking for the macrophages, and it will pick up the macrophages / monocytes. We're not going to worry about that as much. We're not going to see those in urine. I'm not worried. You really need to know the neutrophils, basophils, and the eosinophils. Those are the primary ones that we're looking for with this stick. Sensitivities, the multi-sticks, 5 to 15 cells per high power field, and microscopic chem strips, 10 to 25. We'll know about lymphocytes, the new slide thrown in. When we see lymphocytes will not be detected on the stick. So one time, some of the things you're going to see is why did we have a negative strip, but we saw white cells on the microscopic? This could be one of the answers. This could be one of the things, lymphocytes. Lymphocytes, when we see them in a urine, usually it's going to mean kidney transplant rejection. So that's the big thing you need to know about lymphocytes in urine is kidney transplant rejection. They kind of go hand in hand. Interferences, false positives and false negatives. So interferences, anything that's going to color that pad. That beautiful little pad is this cute little, beige color. Any of those light colored pads, anytime we have a dark colored urine of any sort, it's going to hide colors and cause interferences. False positives, strong oxidizing agents and bleach. That's a really good go-to if you don't know for a false positive. Bleaches and oxidizing agents are a good guess for your false positives. Formalin, poorly collected specimens with vaginal contamination. Remember we talked a clean catch, a woman needs 5 hands for the clean catch. It's really, really easy, so we always expect, every female urine, I always expect to get a handful of white cells because of contamination. False negative, we see a decreased results with high glucose. We see that. Certain antibiotics actually cause a false negative, which you put this patient on an antibiotic for a UTI and it's going to look clean, but it might be there because you get a false negative. You got to always keep that in mind. Most UTIs, we do not go looking for effectiveness of treatment, especially while they're on treatment, because bacteria are there or not. It doesn't matter how many are there because, again, it depends how long it's sat and how many times it's had its doubling time. Ascorbic acid, there it is again, right? Our false negative, and then a high specific gravity. Same with the red, as it was with the red cells, they're going to crenate. These cells have to hit the pad and kind of bust open. The granules have to be able to hit the pad. So if these cells are crenated, you're not going to be able to get those granules to hit the pad very well, so you can end up with some false negatives at that point. Confirmatory tests for both positive nitrites and positive leukocytes are going to be a microscopic exam. We're going to look at the sediment. We're going to talk about that in the next lecture. Confirmatory tests, if the chemical and microscopic tests both indicate the presence of white cells and bacteria, oftentimes it's going to be reflexed to a urine culture, especially if we know it was a clean catch midstream. We're going to send it off for a urine culture. You're going to put it on a blood and a gram-negative select plate to see what's growing. You're going to streak it out so you can count because we want to enumerate how many bacteria are on there. If the culture is positive, they're going to do antibiotic sensitivities. to see what antibiotics will work against those bugs. Interbacteriaceae in particular, you can never count on what antibacterials to use. Because antibacterials and the gram-negatives are all over the board with what they're resistant and sensitive to. There's no good like this will always work, because it doesn't. Symptoms of a UTI with UA results. So we got cystitis versus pyelonephritis. So we got the lower UTI, bladder and lower, and kidney and upper. Urgency, frequency, dysuria, positive for both. So your physical symptoms are going to be the same whether it's high or low. With cystitis, probably no or really low-grade fever. We're not expecting big fevers. However, when you have pyelonephritis, you do get a higher fever and you get the flank pain. Remember, because this is where your kidneys are, so you start having pain there. Urines are both cloudy, nitrite positive. If it's gram-negative rods, they both are leukocyte esterase positive. They're both going to show white cells and bacteria. However, pyelonephritis may show white cell casts and bacterial casts potentially. We'll talk about casts in a couple lectures and what they are. But signs with higher UTI, we're going to see casts. That's really the main difference between the two. Yeast. Yeast are a little bit different because yeast aren't bacteria, right? Yeast do not reduce the nitrates to nitrites. There's no way to detect yeast on a stick. You don't see yeast until you actually do the microscopic. When you're looking at yeast, you can see here, these are red cells, and these are budding yeast here and here. Here's a budding yeast, here's a white cell, that looks like, make it a little, here's a red cell, here's a white cell, here's your budding yeast. So, it's a lot easier to tell you've got yeast once they're budding, and that's how they duplicate, they bud. Yeast tend to be a little smaller than a red cell, a little more ovoid, and they have a little bit thicker of a cell wall than a red cell. Those are some ways to differentiate when you're looking at one over the other.
So when you're looking at that,
Miss
cells
Nuss?
that's 9 o'clock to that budding yeast and clock down. Right, yep. That's a yeast.
That's probably a yeast too. Yep, these are both probably yeasts.
Okay.
And that is probably a red cell. Something that's really hard, it's really hard on a picture to tell. When you start doing microscopics, one of the things we do is play with that fine focus. Because you gotta remember, you're looking at three-dimensional things. They're tiny, but they're three-dimensional. So I'm always gonna be saying, play with your fine focus, play with your fine focus, play with your fine focus. Because that'll help you see. When you're looking at a red cell, when you're going back and forth, so you remember how the red cell's biconcave, right? How do I? I'm trying to make, I can't draw it. But yeah, it's got the, so when you're looking at it from the top, as you're going up and down, the center gets bigger and smaller as you're going up and down because it goes, you know, it's scooped in the middle. And a yeast, it's more rounded. So when you're going up, it just looks different. And so you'll get a feel for what these look like. We do a lot of microscopics because it's really important for you to learn what they look like and how to tell things apart. So here's a bunch of the objectives. As you're studying this unit, go through your objectives, more objectives, bunch of key terms. Take your time, go through these key terms, make sure you know what they all are.